For months, members of the public have been demanding changes to policing so that they're no longer the first to respond to people in crisis. Today, the Toronto Police Services Board voted to expand mobile crisis teams to help with mental health calls. But critics say police aren't listening to their demands.
This goes directly against what the community has been asking for.
Calls to defund the police and to expand community-based crisis response initiatives have echoed loud and clear throughout the summer. In the months since the deaths of Regis Korchinski-Paquette and Ijaz Chaudhry, there have been demands for a change in the system so police would no longer be the first to respond to cases of emotional crisis or distress.
We'd love to see more mental health nurses. We do not need to have a uniformed police officer with a gun and a taser showing up to an emotional crisis call. We know that when the police arrive, they often escalate the situation. They often make the situation more stressful, more tense for the person who's really just looking for help and support.
At a Toronto Police Services meeting today, the board voted to expand the Mobile Crisis Intervention Team, which pairs a mental health nurse with a specially trained police officer to remove people experiencing mental health crises from situations where they may cause harm to themselves or others.
I don't know why we would need to have a police officer paired with a mental health support worker when the mental health support worker is the one who's trained to actually do this job well.
But the police board says this is a step in the right direction and an improvement from solely sending police officers to mental health calls, which is what is happening the majority of the time.
Unfortunately, TPS is the default crisis response 24/7.
Currently, there are 10 mobile crisis intervention teams that operate in the city 7 days a week. In 2019, the teams attended more than 6,400 calls for service. They only arrived first on scene for a quarter of all cases.
To expand non-crisis alternatives is vitally important.
So the goal is to redeploy existing officers to increase the amount of these teams across the city and provide coverage to all divisions.
It's going to be it's much more robust program that's going to have 7-day, 24-hour coverage.
Also on the agenda today, the TPS reported its latest update on its ongoing efforts to collect race-based data. Plus, they tabled a report to move forward with the purchase of next-generation 911 technology so that soon they may receive videos or texts from the scene of an emergency. For City News, I'm Yazdani.